These questions or statements? Because I can answer that question if it's actually a question.
Do you believe in having the ACA that is about to expire? Do you believe in doing something about that?
The Democrats had two chances to make them permanent, and they didn't for a reason.
We're the ones who delivered it. So I'm just asking, yes or no, do you want to do something about this?
Senator Maria Cantwell comes armed with charts, data, and righteous fury when confronting HHS Secretary Robert F. Kennedy Jr. After he cancels $500 million in mRNA research, she doesn't hold back. You're a charlatan. Displaying evidence of vaccines preventing 99 to 100% of diseases, Cantwell demands answers Kennedy won't give. The clash escalates into personal accusations and dire warnings.
You know, I represent one of the most science-based states in the country. That is, percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. Do you say yes?
I said the president also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
you canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because of the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements? Because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits?
Yes.
Well, the Democrats had two chances to make them permanent, and they didn't. And they didn't for a reason.
We're the ones who delivered it. So I'm just asking, yes or no, do you want to do something about this? Yes.
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease. But you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts at Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
This explosive confrontation between Senator Maria Cantwell and HHS Secretary Robert F. Kennedy Jr. represents one of the most direct and personal attacks witnessed in recent congressional hearings. Cantwell's decision to call Kennedy a charlatan to his face marked a complete breakdown of typical senatorial courtesy and signaled her belief that the stakes are too high for diplomatic language. Cantwell's questioning strategy centered on forcing Kennedy into yes or no answers he seemed unwilling to provide. Her repeated question about whether President Trump deserved recognition for Operation Warp Speed and the development of mRNA vaccine technology was designed to create an impossible position for Kennedy. Acknowledging the success of these vaccines would contradict his public skepticism about vaccine safety, while refusing to answer made him appear evasive and ideologically rigid. Kennedy's attempt to thread the needle by saying Trump deserves a Nobel Prize while simultaneously criticizing the mRNA vaccines themselves satisfied neither position. The visual element Cantwell introduced, charts showing the dramatic decline in vaccine-preventable diseases from the 20th to 21st century, with reductions of 99% to 100%, provided powerful evidence for the historical success of vaccination programs. These weren't abstract arguments, but concrete data demonstrating that vaccines have prevented millions of cases of diseases like polio, measles, and whooping cough. Her presentation of this evidence served to counter Kennedy's narrative that vaccine programs have been failures or cover-ups. Cantwell's focus on Kennedy's cancellation of $500 million in mRNA research funding revealed her concern about America's competitive position in biomedical innovation. Her question, what country is going to now take up that technology lead, framed the issue beyond immediate public health to national security and economic competitiveness. If the United States abandons leadership in vaccine technology development, other nations will fill that vacuum, leaving America more vulnerable to future pandemics and dependent on foreign scientific advances. The exchange about the Affordable Care Act premium tax credits briefly shifted to healthcare access, with Cantwell attempting to pin Kennedy down on maintaining subsidies that help millions afford insurance. Kennedy's response that Democrats had two chances to make them permanent deflected responsibility while claiming he wanted to fix the system through lower premiums. The bizarre interjection about women on the Capitol steps discussing the Epstein case seemed designed to suggest Kennedy is disconnected from current events or selectively ignorant about controversies. Kennedy's claim this was the first he'd heard of it struck Cantwell as implausible, leading to her accusation that he perpetrates hoaxes. This appeared to reference Kennedy's history of promoting conspiracy theories and suggested his professed ignorance was itself dishonest. Cantwell's closing statement that she doesn't support Kennedy's continued service as secretary was remarkably direct. Most senators, even when strongly disagreeing with officials, couch their opposition in procedural terms. Cantwell's personal condemnation, calling Kennedy a charlatan who undermines healthcare delivery and abandons scientific leadership, represented a complete rejection not just of his policies but of his fitness for office. Her promise that the Northwest would continue to lead on all innovation and all healthy people suggested a potential fracturing where states pursue independent public health policies in defiance of federal guidance. Kennedy's attempted interjections and requests to provide detailed discussions were consistently shut down by Cantwell, who maintained control of her time and refused to allow him to reframe the debate. This tactical choice prevented Kennedy from deploying his typical rhetorical strategies of pivoting to pharmaceutical industry criticism or chronic disease statistics. This exchange illustrates the profound distrust between Kennedy and substantial portions of the scientific and medical establishment. Cantwell's willingness to use such harsh language reflects a belief that normal political disagreement is insufficient when she perceives Kennedy's actions as actively dangerous to public health and national security.